Here's an example of Post Ortho Relapse. Patient had braces years ago. Lower fixed retainer broke and the teeth shifted. Commonplace, we see this quite a bit. Typically what we do, remove the fixed lingual retainer, 10 trays, get them corrected, give them the aligners. Very easy case. And in this video, we see the treatment plan of the Post Ortho Relapse. This is another one of my favorite cases that come in. uLab has virtually removed the retainer for us. Typically, the way that we work it, the patient comes in, we just remove the retainer and get started with the trays. So a couple things we look for, we go through the same process. I typically look from the front like we talked about before, kind of just see how things look. We look at the smile line again, and I'm not so much concerned about this. Mandibular teeth, typically, we're not as concerned as so much with the smile line as more of occlusion. Usually the maxillary anterior teeth is kind of the sweet spot for that smile line in there, and it's really not affected in this area. Also look at the attachments, make sure there's no interferences with attachments. We also do the same view from the back wall, kind of get an idea of kind of how things are moving. Yep. And then we're going to check the front. Looking good. Then we do the side views. And the other side. Looks good. We're going to now focus on the mandibular anterior, which again was the patient's chief complaint in there. So we're going to back up here a little bit. So as we go through the sequence, typically it's the same thing. I follow through to see if there's any interferences or concerns. Now, as we notice from the beginning, this is about 7 trays, 7 aligners in there. Looks like we're accomplishing pretty good with this for the most part. Things that I look for, because our focus is this mandibular anterior area, are the attachments with this, the amount of movement that we're moving in here. Now, if you notice, there are a couple of areas a little bit of a concern in there. Now, we talked about this before with the other case. We have collision check and the bite checks on, both together here. If you notice, the canines are heavy and red across there. So there's going to be occlusal interferences with this case. Typically for these cases where there's a lot of action and bite load on these canines, I'll add a attachment to the premolar just to support the back of it as we go through. So in this case, I'm a little bit more comfortable with a couple more attachments. As I go through and play through this, we see there's also collisions across there as well. So this patient is going to probably require a little bit more IPR than the previous cases we worked with as well. As we get started, most of that IPR, like we talked about before, is in the first tray. As we go through the case and more movement in here, this patient may need a little bit of an additional IPR because of the collisions towards the end. So things to look out for when the patient comes in. Probably some incisal adjustment just to help out a little bit. Help reduce this red so these teeth can move through the trays. Part 2, probably sequential IPR. In this case, I'll probably start a little bit of IPR in the beginning. I may add the IPR away from the central incisors because they're typically a little bit more narrow than the laterals. Typically when I start my IPR, I typically go laterals on each side. And then as we go through the sequence, I'll add a little bit in the centrals. This case is going to probably also require a little bit of extra IPR on the distal of the canines. As I look across here and go through the sequencing, I'm seeing a lot of interference here with this canine in particular right here, and also occlusal interference as well. So I would probably go back and then have additional IPR, probably about another 0.3 IPR distal here, and then measure this out probably around the 4th tray in that range. And I may considering add maybe 1 or 2 more trays with this sequential IPR as well. But that's it. This case turned out great.